are excited to have Dr. Joe Simpian with us today to give this keynote address. Joe is a professor of economics and education policy at New York University, and his research focuses on the use and development of novel and rigorous methods to study equity in policy, particularly concerning language minorities, gender, and sexual minorities. And I actually came across Joe's work when I was doing my own research. I was writing some of my own papers on data quality online. And I came across Joe's work, not because Joe was doing similar research online, but because he was actually doing research not online. And he was using some really large-scale, federally funded database research. And he was finding some data quality issues that were very similar to the kind of data quality issues that we see when we conduct online research. And it was just incredibly fascinating for me to see that data quality issues really span many different areas of research, right, that's being done. And as we heard in the previous sessions from a friend in corporate research, online research, and now we're going to see a different domain where the same issues apply and the same problems occur. And it's just fascinating to see some of these similarities. Joe's research has appeared on NPR and the New York Times. It's really fascinating stuff, looking at how data quality problems influence and create problems for different kind of minority groups. So thank you, Joe, for being with us today, and we're really looking forward to your talk.
So I'll just tell you a little bit of background how I came to this work. Actually, it goes back over a decade when I was a faculty member at the University of Illinois at Urbana-Champaign. And one of my colleagues there, Dorothy Espelage, who studies bullying, victimization, and mental health of adolescents, she and I came together for a different purpose to talk about different research things. This was at the time around like 2008, 9, 10, when there was a lot of media attention on, just minimize that. There's a lot of media attention on high elevated rates of suicidal ideation and suicide attempts and actual suicide completions by LGBTQ youth. At the time, we were saying, well, is there something we can do to bring some research base to this as well, so we can help inform the discussions a bit more? This was at the time that the It Gets Better project was started, if you remember that. And so we were really trying to just bring some research evidence to this. We had written a paper that was looking at bullying victimization rates and how they differed between LGBTQ and non-LGBTQ youth, that's lesbian, gay, bisexual, transgender, and questioning youth. And in the review process, a reviewer asked, well, how do you know if the kids are telling the truth? And at first I thought, well, you know, it's a self-administered questionnaire. How do we ever know if somebody's telling the truth? But then I was giving some more thought to it and thought, well, you know, maybe it's the case that maybe there is some sort of systematic bias going on, and maybe there's a way to detect that systematic bias with the data that we have. And the data that we have were existing surveys. So there wasn't something where we were going to go and collect additional data. So I was trying to think, how can we make use of the data that are already collected to do, in effect, what Joe, one of the speakers in the previous session, was talking about with post-screening. And how do you do that when you had no relationship to the data collection process? So that's kind of the beginning of this work. And then it kind of spun off into it being its own line of research that I've been conducting and replicating and refining over the past more than a decade now. Okay, so that was a bit of a long introduction, but here I will go into this now. I'm actually going to start by talking about an example that's not my own research. It's an example looking at disparities between adopted youth and non-adopted youth using the AdHealth dataset. Now, for those of you who aren't familiar with the AdHealth dataset, this was is a large, nationally representative longitudinal study. They started with adolescents in the mid-90s gave them self-administered questionnaires. It's a longitudinal study. They followed up with them with interviews with additional self-administered questionnaires, by talking to their parents, by talking to people at school. They followed them. They're still following them now, and they're looking at development over time. So this was a very innovative, very involved, large, very heavily funded, large-scale research study, and it produced many different papers. There's about, I think there's over 9,000 research products that have come out of this study, and I'm going to tell you about one of them. So one of the earlier studies that came out of this was looking at disparities between adoptees and non-adoptees. And they reported in their study on their results, they said, standardized mean differences showed that adopted adolescents are at higher risk in all the domains examined, including school achievement and problems, substance use, psychological well-being, physical health, fighting, and lying to parents. Basically, everything that they looked at, they were finding disparities between adoptees and non-adoptees where things were looking worse for the youth who reported being adopted. Later in this paper, and this paper was published in Child Development, and again, for those of you who may not be in the adolescent health and adolescent well-being world, this is a top-tier journal. I clicked on the wrong button. Later in the paper, they then go on to say, the high degree of consistency across many measures with this large and representative sample adds weight to the validity of the findings and makes them more conclusive than those of many previous studies using fewer outcome variables with small or biased samples. So again, they have a lot of faith in their research findings, and they're pointing to a very large sample and all of the money that went into this as evidence for these results being conclusive. So 1 year later, the ad health researchers followed up with a subset. And for the purposes of this study, it's about 15,000 individuals. So they followed up with those students. And in addition to following up with those students with in-person interviews, they also this time followed up with their parents and guardians. So what we see now is the ability to triangulate responses. So previously, when the students filled out the self-administered questionnaire, among this reduced subsample of students, there were 464 of them who reported being adopted. Now, when they're doing the interviews, they talk to the parents and the guardians and they ask them, is Billy your biological child? Does at least one biological parent live with Billy? And what they found was pretty striking. So 88 of the 464 adopted youth misreported that they were adopted. I'm saying misreported here. The authors actually called them jokesters, and they basically implied that there's some sort of mischievousness at play. And so this is about 19% of the kids who said they were adopted. They couldn't then verify that by talking to the parents, guardians, and in addition to this, I don't have it on the slide, but they also talked to the kids and asked them again, are you adopted? And at that point, the kid said, no, I'm not adopted. So what does this mean? So now I have a couple different things up here to show you from their results. So if we take a look at one outcome variable, positive feelings about school, we see that if we look among the kids who are true adoptees and non-adoptees, then these are in terms of standardized differences. So like a Cohen's D estimate, there really is virtually no difference between whether or not you have positive feelings about school if you're a true adoptee or a non-adoptee. However, when we look among the false adoptees and compare them to the non-adoptees, the false adoptees are saying about an entire standard deviation lower positive feelings about school. They're also saying about 2 standard deviations higher that they have skipped school when actually there's really no differences between skipping school among the non-adoptees and the true adoptees. So overall, what we see is there's virtually no difference in reality, but we have these jokesters who are pretending to be adopted on the survey when they're not. And what they're doing is their results they're so different from the true adoptees that they're making the true adoptees look worse in every dimension that's examined. So I'm not going to show you here, but they also looked at this among kids who reported being immigrants And what happens is you see that kids who are not immigrants are reporting that they are immigrants and making the immigrant population look worse. They also found that 99% of the kids who said that they were amputees, yes, you heard that correctly, 99% of the kids who said they were amputees were not amputees. So all of the data that they had on amputees, they basically realized were worthless. So, so there were a lot of problems with this, again, very well thought out and heavily funded research study. There's a lot of good things about it too, so I don't want to make it sound like the entire thing was completely problematic, but we can see there's a number of instances where there are problems and these problems were caught. So you might think, oh, wow, I want to stay away from the ad health data set if I'm a researcher in this area, but that's not really the right takeaway. This is not solely an ad health problem. And in fact, the ad health data set is nice because we have the ability to triangulate and to have some sort of validation checks that may or may not have actually been intended, but we can figure that out. The bigger problem is that most studies don't actually have a clear way to assess the extent of the concern. So now this is coming into where my research comes in, where we're working with data sets that are existing, that people are regularly using, but there aren't ways to triangulate. So what can we do with those types of data? So one of the types of problems that we have in these data sets is what I call a mischievous responder. So I guess Efren also had a little devil character in his talk in the previous session. So I also have one in mind. So I guess it might be a common theme. Maybe you'll see more devils pop up in the sessions today. So the idea with the mischievous responder is we have to think about two different kinds of things. So again, I'm really working with data that are adolescents, but this likely translates into other contexts as well. So the two things to think about are what is the truth, and then what he reports. And what he reports, we can kind of loosely think of as funny. He might have the mentality of, you know, I'm at school, you're making me fill out this survey, you're kind of wasting my time, I'm gonna waste your time, and I'm just, you know, why should I trust you? I'm gonna fill out what I find is funny on this survey. So I'm looking at disparities between LGBTQ and non-LGBTQ students. So that's kind of gonna be the focus for the rest of the talk, but so you'll see that in some of these examples here. In the previous example, we had the truth was people were not adopted, but they were reporting that they were adopted. And a lot of the studies that I'm doing, the truth is that they're heterosexual, but they report they're gay, for instance, or they are cisgender and they report that they are transgender. So there's a common pattern where individuals are choosing responses that are of a minoritized population or some sort of marginalized population, perhaps because they think it's funny. So then if we look at the outcomes that are oftentimes of interest, and one of the outcomes that we care a lot about, and as I was telling you about when I was first giving the setup, is thinking about suicidal thoughts and suicide attempts. So in this case, the truth is that this mischievous responder is not suicidal, but on the survey, he fills out that he's suicidal. The problem is that now he's elevating the perceived risk that we're seeing for these other groups that he thinks is funny for them to be suicidal on our surveys. He skipped school. So he said, that's the truth. And he says he skipped school. Well, you might think, well, that's good. He's telling the truth in this case, right? That's not good because again, skipping school is not being attributed to non-adopted heterosexual cisgender individuals. It's instead being attributed to adopted gay transgender individuals. So there I was sitting in my office back in Urbana-Champaign thinking, what can I do with these data where we have these likely problematic patterns going on? So there were a lot of other questions that were asked on the survey, and I thought, well, maybe we can make use of them. If there are other items that are asked on the survey that we think shouldn't be related to, or at the time I was thinking maybe are inversely related to the groups that we care about, then maybe we could use the collection of these items as a way of screening out people who are potentially mischievous responders. So here are some examples of things that were on the survey. at the time, the survey that we were working with asked, do you have any children of your own, right? So one of the options was no, I don't have any children of my own. Another one was I have one. Another one was I have two or more. They asked, are you blind? They asked, are you deaf? Are you in a gang? They asked about your height and you filled it in, and then we kind of took the distribution and looked to see about extremely tall or short responses. And then have you seen a doctor? And they had, in the last year, the last 2 years, and goes on, and when I haven't seen a doctor in 5 or more years. So we kind of were taking the extreme responses among a collection of items that we didn't think should differ between heterosexual and gay, or cisgender or transgender youth. And we were seeing if there were extreme responses that we could then use to identify who the likely mischievous responders were. So in this case, for our mischievous responder, on all of these screener items, the truth is no. However, thinking about a prototypical mischievous responder, that person would respond affirmatively to all of these low frequency, extreme, and potentially funny kinds of options. So what we're trying to do is we're trying to look, are there things that somebody might be drawn to, similarly to how they might be drawn to other outcomes, demographic things that they really shouldn't have any sort of relationship with. Okay, so how does this work out? Well, there's a lot of text here, so I'll go through just a couple examples here. So the items that we were working with, again, we were working with what we had. We identified 10 different items, and one of them that I'm highlighting here is, are you blind or have a vision impairment? The low frequency response option, which we were using for a screener, was yes. Among the people who identified as cisgender, about 3% of them said, yes, I'm blind or have a vision impairment. Among the people who identified as transgender on the survey, again, I'm putting this in quotes because we don't necessarily believe that they're filling the survey out accurately, but 31% of them said that they were blind. You could see that there's elevated rates of reporting each one of the low frequency response options. So it's a very common pattern that's going on. We were also interested in differences between heterosexual and LGBTQ individuals. So looking, instead of along the gender identity dimension, looking among the sexual orientation dimension. And we see a similar kind of pattern where are you blind or have vision impairment? It's about 3% for those who were reporting being heterosexual and about 14% for those who were reporting being LGBTQ. The difference between these two things is diminished when compared to the transgender cisgender, but when you also look up here at the sample sizes, you see that transgender is a less frequently chosen option, because particularly at the time that the survey was conducted, a lot fewer people were identifying as transgender. So the actual real transgender identified population was smaller than the actual real identified LGBTQ population. And so what we see is, this is another common thing that happens in this line of research. The numerically smaller the population is that you're interested in, the more potential for mischievous responders to distort their results, just because there's just going to be disproportionately more mischievous responders relative to actual respondents in those instances, if somebody is consistently being a mischievous responder in all these different dimensions. So what I had suggested doing in a previous paper was looking, this is a very simple kind of approach. If we have 10 different screener items, as we had here, then what we could see is, well, how many low frequency response options did somebody give in the different conditions? Now, among the cisgender reported individuals, 5 of them out of over 11,000 of them gave all 10 low frequency response options in the screener. Compare that to the transgender population. There were only 200 transgender reported individuals in the sample, yet 17 of them affirmatively answered all those screener items. So what I had proposed doing was seeing what the results are if you include everyone in the study, and then successively removing the most, those individuals providing the most low frequency responses, and then seeing how your results change over time. Not over time, as you have these different subsamples. So we can look at how that looks with the extreme suicidal ideation outcome. This is reporting thinking about suicide almost all of the time. So this is the transgender cisgender disparity. This is a standardized measure. So it's in terms of standard deviation units. And what we see is if we have the full sample, there's no screening being done, then transgender individuals are reporting that they think about suicide almost all the time at a rate that is 2 standard deviations higher than cisgender individuals. These are 95% confidence intervals, and you could see that that's nowhere near the 0 line. So this would be would have a very small p-value and would be deemed statistically significant. If we remove individuals who provided 6 or more low frequency response options, then we see that this estimate goes down to about 1/4 of a standard deviation, and it's no longer statistically significant. If we remove individuals who provided 3 or more low frequency response options, and this dashed line here indicates that by that point, we've now removed 2% of the total sample. So we still have 98% of the sample remaining. So it's not like we're removing a ton of data at this point, but we could see this is exactly what we expect to have happen. It's a small sliver of the total sample that is being mischievous and is throwing off all the estimates. But when we do that, then we see that the estimate goes down to 0. It's not statistically significant, and we haven't removed too much data. We still have the majority of individuals who say that they are transgender and the majority of individuals who say that they are cisgender. So over time, I've been working on this and developing different ways for identifying who the likely mischievous responders are. And that work's actually broadened so that it's not necessarily thinking just about mischievousness. That's kind of what started the work, but I think it's actually better to think more flexibly and think about valid data, insincere responders in a more general sense. And if we do that, then we can try to attack this problem more flexibly and in a way that just isn't so rigid. So in the previous, my earlier work, I was looking at count-based measures of identifying individuals who were likely mischievous responders. What that requires is it requires identifying the screener items. It also, here, I'm gonna put this on. There's some human, basically what I want you to focus on here is there's gonna be a human component to all of these approaches, and then there's going to be a data-driven component that is coming into the more recent approaches that I've been moving towards. So this human component here, we have to identify the screener items. We have to say, what are the screener item response options that are funny or should be indicative of mischievousness. When we do this, it's easy to count up how many there are, and it's relatively transparent to show someone, say like, look, this person provided 10 out of 10 low frequency response options. I think that they are a likely mischievous responder. You do, as you saw in the previous slide, there are lots of possible estimates though to get. Do you stop screening out once you remove people who provide all 10 low frequency response options, or would you screen out somebody who provides 6 low frequency response options, right? I mean, there still is a very low probability that somebody is going to provide 6 or more low frequency response options, right? And you might think, well, they're a mischievous responder too, but somebody else might disagree with that. So there's a lot of possible estimates, and it can be a little confusing, I think, for presentation purposes, for people to think about, well, where do I stop? The researcher has to specify how things get combined. And what I mean here is with a count-based approach, every one of those low frequency response options counts the same. If you give an extreme height, it counts the same as if you say you're in a gang, it counts the same as if you say you're blind. And maybe those different response options should be counted differently in terms of identifying differences between the groups. So that was the earlier work. You also see down at the bottom, this kind of dovetails with the open science movement in social science and psychological research. And we started to build in registered reports of, so not just pre-registration, but actually submitting to the journal, this is what we plan to do. We haven't looked at the data. We don't have access to the data, whatever the case may be. And do you approve of the research approach and what we are saying that we're going to do? And do you think this is a worthwhile activity? And if we do this work, is this something that you would publish? So this prevents against p-hacking, not only by having the pre-registration, but by going through the review process as well in advance. So it's I think this is very important for this kind of work, because what I've also found is not everyone embraces the thought that there are potentially mischievous responders or invalid data in these data sets. And so I think when you're introducing something like this, that for some people and their careers is a little bit earth-shattering, that it's good to say, this is what we're going to do in advance. And is everyone on board with this? Yes, okay, let's do it. And what are the results? So we're not, in a sense then, we're not trying to find somebody who's mischievous and altering our methods for doing that. We're saying, this is what we're going to do. Haven't seen the data. What do we find? And so that's what I'm going to show you today. These later approaches that we move to, they are also, as I said, they're more data-driven and more flexible. So we're going to combine an approach from the machine learning world that's a boosted regression, where through a cross-validation process of trying to minimize the differences between the individuals who identify as LGBTQ and those who identify as heterosexual on their screener response options, we're going to try to minimize them and find individuals who match up on things that shouldn't be related to identifying as LGBTQ or heterosexual. And that is all done algorithmically and allowing for higher order interactions that we as the researchers don't have to pre-specify. We do still have to pre-specify as researchers what those screener items will be. So there is a human component to it, and it's an essential human component, because we wouldn't want to let the algorithm run wild on all the data, because another item that is asked is which individuals of which sexes have you had sex with, right? And so if you're a male who says, well, I've had sex with males, well, that's gonna be highly predictive of you identifying as gay, right? And we wouldn't want that, because that's a valid identification, right? So that, since it's a valid item, it would be an invalid screener item to include. We only want things that shouldn't be related. Okay, so I mentioned that this is a registered report. So what we're doing is we're using the 2019, the YRBS is the Youth Risk Behavior Survey. It's a survey that is collected by the Centers for Disease Control and Prevention, the CDC. It's collected every 2 years, and it's a nationally representative sample of high schoolers. They also have a sample of middle schoolers as well, but we're only using the high schoolers. And what we're going to do is we're going to, as I said, combine a machine learning approach, which is a boosted regression, with a propensity score reweighting approach to minimize the likelihood of potentially invalid responses between LGBTQ and heterosexual youth responses. I mentioned that previously my work is focused on mischievousness, but there's a lot of other pitfalls to working with these self-administered questionnaire data too. There's inattention. These surveys are long. There's over 100 items in this, and you're asking teenagers to sit there and to fill this out. So they might be racing through it. And so it may not be that they're necessarily mischievous. It might be that they're just inattentive, or as the survey goes on, they may become inattentive, or maybe they're just identifying a very easy answer for them and not putting much thought into it. And maybe the way that they do that is by going with either the first choice or the last choice. So it may not look like a kind of random pattern, but it might be some sort of ordering effect or some sort of satisficing effect that's going on. It could also be a combination of this. So in this approach, we don't have any priors about which specific kind of motivation is going on, or if it's changing or not as somebody goes through this survey. You might start out honest, and then you're like, oh, the survey's going on forever, right? And you're just gonna start changing in terms of how much attention you're giving to it, or if you decide to be mischievous or not. What we did for this registry report is we used the 2017 Youth Risk Behavior Survey as kind of like a pilot to demonstrate like a proof of concept to the reviewers, but we had never seen the 2019 Youth Risk Behavior Survey. And only now, after we've had, this is not a beer, this is an in principle accept. So after we had that in principle accept, then have we moved on to use the 2019 Youth Risk Behavior Survey. So the overall big picture of the process is what we want to do, and this will become kind of meta in the end, because our work has both a like a substantive thing for a substantive component for individuals who are interested in disparities between LGBTQ and heterosexual youth. And so we want to address that, but it also has this methodological component where we want to say, if we think about this as some sort of research process that everyone can use and that's broader than the specific topic that we're applying it to, then we want to assess the robustness of this process and also indicate to other researchers how they could use this, which is probably the reason many of you are here for this talk. So the first step is we want to identify screener items, items that should not ostensibly differ between the groups. And I'll show you examples of what those are in the next slide. Using those items, we then want to predict group membership from those items. And this is done using a machine learning algorithm. So we're actually going to predict whether or not you say that you're LGBTQ or heterosexual on the basis of how often you say you eat carrots, or how often you say you eat salads or potatoes, or what you say your height is, because those are things that we don't expect to differ between LGBTQ and non-LGBTQ youth. However, what's interesting about them is they have response options that are funny, or if you are having a random response pattern, then we'll see these unusual random kinds of patterns popping up only in one particular instance among like LGBTQ versus heterosexual youth. These are things that we'll be able to capture in the algorithm. So that's what's happening in step 2. Step 3, we're going to create weights that will equalize the likelihood of invalid responses between those groups. Step 4, we're now going to use those weights to create adjusted disparities and see what those disparities are. Step 5, we estimate unadjusted disparities. Now, step 5 is basically the step that everyone would go to if they weren't doing some sort of validation check. But because we're doing these validation checks, we have a lot of extra work to do in advance. And then we also have some extra work to do later, where we're going to compare the disparity estimates that we got in steps 4 and 5. Now, this is where it gets a little meta. We're then going to, so this is an important step where you identify the screener items and you say, what's actually going to go into the algorithm? How you identify that matters. And we want to see, is the process of this entire post hoc screener adjustment, is it itself sensitive? And are the patterns that we're seeing sensitive to the items that are included in the screener? What if we remove some items that maybe the literature says maybe we shouldn't include? Of course, the literature itself might be biased because it's based on biased studies. What if we add some items that maybe we shouldn't include? How much is it changing the estimates that we get? So it's a slightly counterintuitive approach, maybe not to this audience, but you want to use items that are theoretically unrelated to identification of LGBTQ and use that to predict reporting that you're LGBTQ. Now, this is you might think, well, this is a terrible approach. Why would, if this weren't trying to identify mischievous responders, if you were trying to predict something, you would want to think of things that are conceptually related in the prediction process. In this case, though, that would be a bad thing. So we want to think of things that are not related, but that might have response options that would draw someone to them similarly to how they would be drawn to reporting that they're LGBTQ if they were being mischievous responders, inattentive, satisficing, some sort of data error reporting. So the items that we're using are carrot eating, salad eating, fruit eating, potato eating, height, whether or not you say you have asthma, dentist visits, and then we're also using the survey weight because there really shouldn't be differences between the probability sampling of people as well. Then we remove some items in different ways to check for the robustness of the process. And then we also add some items that are, we think, bad items because there still are disparities in terms of bullying between LGBTQ and non-LGBTQ youth. And there still are disparities despite diminishing substantially in some cases among LGBTQ youth and non-LGBTQ youth in terms of heroin use. And we want to see how including these bad items might affect the validity of the screener with these other items in there. This is what we had done using the 2017 data in the pilot. This is predicting the probability that somebody reports that they are heterosexual. So what we see is among the and I'm just showing you among the males here. That's where most of the action is going on, as you'll see soon. Among the heterosexual reported males, among those items that we use in the screener, we're predicting a lot of them to be heterosexual males. However, among the LGBTQ reported males, still you're also seeing a lot of them would be predicted to be heterosexual males based on these screener items. That may sound a little weird, like why are we predicting LGBTQ youth to be heterosexual males? It's not that we're using anything that should predict sexual orientation. We're using things that shouldn't predict. So really, there should just be, you know, what's the proportion of individuals who are heterosexual males in a data set, and then that should just give us our prediction. But we do see that there is separation. And when we reweight, what we're seeing is now we're making it look so that what we're doing is we are downweighting the individuals who had a low likelihood of looking like a heterosexual male. Now, I don't want to make it sound like, well, we're making everyone look like heterosexual males and giving them responses. These are items that should not predict anything. But the reason they're predicting things is because there is these kind of funny responses. And we're upweighting these other responses. Down here, what we're seeing is, this is an actual respondent at the bottom of the distribution. They say that they eat carrots 4 or more times a day. They eat salads 4 or more times a day. They never eat fruit. They eat potatoes 4 or more times a day. Their height is missing. The missing height is actually because the CDC recodes biologically implausible values of height to missing. They say they have asthma. They say they've never been to the dentist. In the middle here, we see a kind of a mix of responses. And at the top of the distribution, we're seeing kind of what you would guess would be a pretty standard set of responses. They didn't eat carrots in the last week. They ate salads 1 to 3 times. They ate fruit at least, you know, they ate once a day. Their height is fairly average height. They don't have asthma, and they have been to the dentist this past year. So what do the disparities look like, and how do they change? This is among reported males. There's a lot of different outcomes here. We're looking at 44 different outcomes. Don't focus on this so much. Instead, look here up at the top. If it's a solid line, it is a statistically significant difference after adjusting for doing 44 different comparisons. And if it's transparent, it is not statistically significant. There's a lot of significant differences, and pretty much in almost all the cases that LGBTQ males are at higher risk than the non-LGBTQ males. When we do the adjustment, what we see is a lot of them lose their statistical significance, and they decrease in the risk. When we put these two things together, we see that this first outcome right here, ever use steroids, goes from a very high relative risk of over 3 to about 1. It's no longer statistically significant. And in fact, the relative risk ratio has reduced by 67%. There are some outcomes, though, that really don't change that much. So being bullied at school, that doesn't change significantly. And these two estimates you see are very similar, and they're both statistically significant. Again, suicidal ideation, considering suicide, being electronically bullied, these are things that really aren't changing. So not everything changes considerably. I know I'm running very low on time, so I'm just going to go through a couple quick things. Females, things don't really change as much, and you can see that right here. So this is also consistent with literature. The males tend to be the ones who are the mischievous responders, not so much the females. This is consistent across pretty much every study that's conducted. So what predicts the outcome variation? Because I showed you some of these things are changing considerably. Some things are not really changing that much when we do identify invalid responses. So maybe it's the item response option extremity. And that is, in fact, what is predicting things. So very few people say that they ever injected illegal drugs or ever took steroids without prescription. And these are the disparities that are changing the most. A lot of kids say that they've used marijuana. So despite this all, these maroon colored ones all being in a collection of drugs, marijuana being relatively commonly used, we see it's not changing the disparity when we adjust for potentially mischievous responders or potentially invalid responders. But the things that are infrequently used are changing considerably. Being bullied at school is fairly common, and it's not changing that much either. Among reported females, these red lines are simulations, and they are instances where we find more extreme responses. So you see the relationship is not statistically significant, but it is going in the same kind of general direction. The last thing that I want to say is, are the patterns robust to screener alterations? We find that they are fairly robust. So these are the correlations among the males of the different screeners that we're using, where we either use the original screener, we remove some of the items, we add some additional items. Up in the upper triangle, we have the correlations among the females. And what I find particularly interesting is along the diagonal. Now, the males and females, we separate them initially because there are different levels of risk, even among cisgender heterosexual males and females. There are differences in the disparities. There's between LGBTQ heterosexual in these two different populations, and there's a lot of differences. But what we're doing now is we have two different samples, and the algorithm is run separately on each of them and comes up with different ways that these different low frequency options are weighted for each of these different groups. Yet what we're seeing is when you have the same items, which tend to be either relatively infrequently used, like the drugs, or more common, like being bullied, we see the same patterns of the items that are changing and their percentages of change among the male sample and the female sample. And I think that is pretty strong validation of the patterns that you're seeing and which items are most likely to be affected across two independent samples and two independently run algorithms. The implications, published findings may not be valid. Researchers should use robustness checks to assess for invalid and mischievous responses. This is very important for we need solid research for policymaking for LGBTQ research, and it's not very helpful to have faulty data out there. Estimated disparities among males seem to be more effective than those estimated disparities among females. Not all outcomes are equally affected. It seems to depend on how infrequent the most extreme response option is. The methods matter. We have a study where we, again, this was a registered report where we were comparing a regression adjustment approach to a data removal approach, and we were finding that the regression adjustment approach does nothing. I had hypothesized in an earlier paper that maybe somebody could just use regression adjustment that would be better than nothing. It's really not better than nothing. So it's good that we've since done this study to check that out. The implications for practice, and this is the final slide. For males, the disparity estimates are quite sensitive to whether or not you use weighting. Male LGBTQ youth look to be at higher risk for almost all outcomes when you don't do any sort of validity weighting. When you do validity weighting, the male LGBTQ youth are at higher risk for a much more limited set of outcomes. These tend to be focused on bullying, victimization, sadness, suicidal ideation, not so much the extreme drug use kinds of outcomes, or drinking, or bringing a gun to school, or any of those outcomes. So practitioners don't have unlimited resources, and the validity weighted results can help people assess the robustness of the findings and think about, well, where do we have the strongest evidence base to put those limited resources? What is something that is consistently coming up that we could address? So that's just a way of thinking about that for practice. Thank you for listening. And yeah, if anyone has any questions, I'm happy to take it. I know there's only like a minute or so left, but.
All right, so we have one question in the chat asking, will it, lost that. Will it increase too much burden for participants to ask that many extra questions?
Yeah, so in this case, the questions were already asked because we were working with existing surveys. And so this should be kind of readily available to people who are working with existing surveys, provided that there are useful items there for someone to use. It might increase the burden, but you may not need to ask too many items. So I think that there are some, yeah, it's different. So I was working with things that people thought were real questions that they wanted to ask, and they thought they were real response options they were asking because somebody cared about how often kids were eating carrots, right? And somebody was caring about these things, and that's fine, you can care about them. They just happen to be items that we didn't think should differ between LGBTQ and non-LGBTQ youth. You could ask things where there clearly is a wrong answer, right? So I know there's somebody has a survey where they say something like, I get paid once every 2 weeks, but it's by leprechauns. And right, so the idea there is, well, obviously leprechauns don't exist. If you say that you're paid by leprechauns, then you're a mischievous responder and we screen you out. So it's almost like it's an attention check kind of thing. I think though there's a potential danger at that point of, if you make it so that it's very clearly there's a right answer and a wrong answer, somebody who's being mischievous might not necessarily go for that trap, right? So as far as I know, there hasn't been a study that is comparing what happens when we have something that's plausible for some people and completely implausible in other cases.
Let's do one more question. How do you have suggestions for people who don't know much about machine learning, or how they can go about using these approaches? Oh,
sure. Yeah. You know, I didn't learn machine learning when I was in grad school, but there was this amazing course on, it was actually on Coursera, and I think they still have it. So Stanford, it's through Stanford, and it was a machine learning course. At the time, it was taught by Tibshirani, Hasty, and like that group that basically has written the Bible on machine learning. I think now it's taught by somebody different, but it has very high ratings and it's a nice introduction. I did that, a few other courses, did a lot of reading on my own. Yes. Anyway, so continue learning, I guess. But yeah, the Tibshirani, Hasty, there's two other authors, I'm forgetting them right now. Freeman maybe. But there's a book, and it's actually public access. So it's open access, so you can just download the book and start learning. But I would encourage you to learn that because it is very powerful for this.
And just a quick follow up, and Rachel, feel free to cut me off if we're way out of time. But just to follow up on that question, is there a quick and dirty way to use that instrument without machine learning? Like, for example, like some kind of rule of thumb. There are 10 questions. If someone answers more than 3 out of 10 in a specific way, then there's a pretty good chance that they're mischievous or inattentive or whatever. Is there something like that? And then, sorry, now I'll ask a similar question just as we go. So is there, one of the things that we found in the past when we've created questions that were fairly effective, like online, I think one of them was mentioned in the previous study, we created this, people refer to it as a brinjal test, right? Mm-hmm. Like you present a picture of an eggplant, and then a lot of like bad respondents online who were coming from India, called it brinjal, whereas like the good respondents called it an eggplant, because it just happens to be that on MTurk, a lot of the problematic respondents are from India. And it was really, really extremely effective. And then we kind of, published something on this. And then within like a couple of months, like every single study had like an eggplant in it, and of course, then respondents catch on to it, and then it stops being as effective as it was.
Yes. So is there,
are you always reusing the same questions? Is there a library of questions that people can use, or how does it work?
Yeah. So something similar happened where they had in England, where they had a study, and they had a fake drug that they listed. And then over time, what you see is the rates of responding to that fake drug just kept decreasing. And so people catch on. And it's like, there's this fake drug here, don't list that or whatever, right? And so you would find that people were saying they do everything except this fake drug ultimately, right? So so I do think there's a danger of reusing items. The items that are currently used in the way that I'm using them, I don't think there is that danger for, because I don't think adolescents, for starters, are reading my research. So I don't think that many adults are reading my research. So I think that, so they're not catching on to this, but I think that there are, so that I'm not concerned about. I think, in your case, there was a monetary incentive. So they, were trying to figure that out, right? So they didn't get flagged for the brinjal and eggplant. So I think that matters. I don't think that there is a very clear set of these items will definitely work. We tried different combinations of items, and something else we were doing to see, like, what if you only include these items, or what if you include 7 items, or what if you include 3 items? They differ, and they're like, the different combinations predict differently the extent of the reduction. And some of them are more powerful for predicting, others are less. I don't think any particular responder is going to necessarily be drawn to the exact same set of responses that someone else would be, or what we necessarily think they would be in these kinds of studies. Also, what we don't think should differ between LGBTQ and heterosexual youth, we might think would differ between low income and high income families, right? So we wouldn't necessarily want to have the same types of items if we were working with existing items, or we might think they might differ differently for different religious populations or something, right? So I think it's incumbent on the researcher to think through what shouldn't differ, what should be valid in my particular context, and to make that argument and make it transparently for people to assess the validity of. I'm sorry, so there isn't a very clear thing, but the clear thing is, think about it.